Concern over the Omicron variant as COVID-19 cases rise around the world. Hello, I'm Mike Walter, sitting in for Anna Naidu, and this is The Heat. The Omicron variant has been found in at least 45 countries. Confirmed cases rose in Britain and Denmark over the weekend, while health officials in the United States report the coronavirus variant has been detected in at least a third of the country. With little known about its transmissibility and how well the vaccines will hold up against it, the WHO is urging extreme caution.
People who are infected with the Omicron variant can have mild disease all the way through severe disease. Initial reports suggest that people with Omicron tend to have more mild disease, but it's too early to tell. And the reason for that is because it takes time for people to go through the full course of their infection. Our message to governments is don't wait to act. Everything that we need to do for Delta will benefit Omicron, no matter how this variant unfolds.
There's a lot to talk about, so let's get straight to our panel. Dr. Peter Chin Hong is a professor of medicine and infectious disease specialist at the University of California, San Francisco. Joseph Williams joins us. He's a former senior news editor at U.S. News and World Report. Also with us is European affairs journalist and author Paul Hockenos. And William Haseltine is the chair and president of Access Health International and the author of Variants, the shape-shifting challenge of COVID-19 vaccine evasion and reinfection. Bill, that title says it all. I mean, you literally wrote the book on variants. How concerning is this one to you? What should we be worried about?
I call this variant the sum of all fears. And the reason for that, it seemed, first of all, to come out of left field. Nobody anticipated that this particular type of variant would arise. And secondly, it contains within it all the dangerous variants we've seen before, plus a few of its own. So this is extremely worrying. Also, the early data suggests, doesn't yet prove, but suggests that it's much more transmissible than Delta.
And what about the concerns about deaths? Because I know that's a lagging indicator. Do we have any idea if it's as lethal?
We don't know that yet. I would point out, however, that in the past, viruses that are more transmissible have a higher hospitalization and death rate than the previous variants. Delta, that's certainly true of from the most recent data. It has both higher infection rate and higher hospitalization and death rates than the others. So if this follows that course, despite early indications that might not be true, it is well within the realm of possibility.
Peter, let me ask you about this variant. It was first identified in southern Africa in late November, but Dutch authorities have come out and said it actually was seen before that on the European continent before it was first identified. Right now it's in 45 countries. South Africa's President Cyril Ramaphosa is pretty upset about these travel bans, basically saying, you know, we're being forthcoming and we're being punished for it. And he's also said, you know, in the West, they've been pretty good about leveling travel bans, not so good about getting jabs into the arms of people who need it. So your thoughts on that? And also, are these travel bans just basically optics where you're trying to say, hey, we're doing something about this, whereas already the cat's out of the bag in a sense?
Yes, a lot going on there, Mike. First of all, yes, the cat is already out of the bag. By the time you recognize the variant, and of course, this variant was seen earlier than probably the other variants were probably noticed by genomic sequencing because of the curiosities of this particular variant having, you know, easy detection. But nevertheless, you know, lots of people travel from these countries in Southern Africa to all over the world. And by the time you figure it out, you know, you're already seeing community transmission in many countries. And to put the travel ban and isolate them to just a few countries when they're probably in other countries just seems kind of ludicrous, particularly since they've never really worked before. Certainly you could think that in the beginning, when you're traveling, trying to limit the potential of spread to the community, it might work. And maybe this is earlier. But when enough people have it, it's like little coronavirus bombs going off, and you get to that exponential curve where it doesn't really matter if you have a travel ban or not.
You know, Peter, Bill was saying, you know, like he's concerned about hospitalization, and as we've been talking about, it's a lagging indicator, deaths, but he does have concerns about that as well. But over the weekend, Dr. Anthony Fauci, the head of the Institute of Allergy and Infectious Diseases, said perhaps there is reason for optimism because he says if you got your booster shot, maybe you're in good shape. Let's listen to what he had to say.
The vaccines that we are distributing now in the United States and throughout the world are directed against the original ancestral or Wuhan strain. And yet, with Delta, when you get a level of antibody and general immune protection high enough, it spills over to protect against other variants. So we're getting quite good protection against Delta when you're vaccinated, and particularly when you get boosted. And that's the reason why we're saying, even with a new variant like Omicron, if you get boosted, you're going to get your level up, way up, and we feel certain that there will be some degree, and maybe a considerable degree, of protection against the Omicron variant if, in fact, it starts to take hold in a dominant way in this country.
Rather optimistic, but for the first time in 2 months, the U.S. is averaging more than 100,000 new COVID cases each day. This is, of course, happening after the Thanksgiving holiday with all these people traveling all around the United States. We're also seeing some COVID deaths actually spiking, a rise within the last 7-day average, 1,600 people, more than 1,600 people dying from the virus each day as of Saturday. Those are alarming numbers, and that's basically, we're looking at Delta there. What are your concerns?
So my concerns are really the fact that we still have millions and millions of unvaccinated Americans and unvaccinated people around the world. We know we're focusing on Omicron now because it's new and everyone's curious. But the fact is, like Bill says, when you have a transmissible variant like Delta is certainly transmissible, twice as much as the original variant, people are going to die. And coming back to what Dr. Fauci is saying, you know, even though your antibodies may wane with, a new variant or even over time, we do know that T cells and B cells, memory B cells, T cells, they're adaptable. They can change to a new enemy, and they can also kick the virus out of the body once it gets in to keep you from going to the hospital.
Joseph, I mentioned the U.S. ban on travelers from southern African countries. Monday, we're seeing some other changes as far as travel for international travelers coming into the United States, some new requirements there. Also, there is a new vaccine mandate in place for New York City. Can you break down what we're seeing today?
Well, we're seeing a lot of action on a lot of different fronts. As your guest previously mentioned, the travel ban was perhaps the first large move that President Biden has made in response to Omicron. He is also talking about the new travel mandates, masks being required on public transportation and airplanes, and basically trying to continue doing what's already been working, what's already been proven to work by science. In New York, however, we've got Mayor de Blasio, outgoing Mayor de Blasio, talking about he wants COVID vaccine mandates for every private employer in New York, which is certain to raise some hackles among people who feel like vaccine mandates are a little bit of a government overreach. But the problem here is that vaccine mandates actually have a good response rate. I mean, if you make people choose between their paychecks and getting a free shot that may save their life, it seems like a no-brainer. However, it's devolved lately into union issues, personal choice issues, but if on the positive side, you do have, when President Biden made the vaccine mandatory for all federal employees, including contractors, you saw the vaccination rate spike up to north of 85–90% in a country where we only have below 70% people vaccinated, more or less. So vaccine mandates, while they aren't popular, certainly do what's necessary to get the virus under control and compel people to choose between their financial obligations and getting something that could be very helpful and will be helpful for the country in the long run.
And these international travelers having to test closer to the actual flight, that's another indicator of some of the steps being taken. But some people, health experts, suggested that the Biden administration could have gone farther, not just international travelers, but also domestic travelers, insisting that if they want to get on a plane, that they have to produce their vaccination records. And, when you think back to 9/11, I mean, all of these requirements went into place. There was these random checks. We had to take our belts off, our shoes off, all of these sorts of things. So it doesn't seem like it's that onerous. And it might also produce more people getting vaccinated. I want to get your thoughts on that.
Well, basically, President Biden is trying to calibrate how far he wants to go in modulating the conflict between science and politics and public health and public choice. I mean, certainly everyone on this panel, probably would agree that it's a really good idea to make this mandatory, but you have a president whose approval ratings hovering in the mid to low 40s, depending on who's scoring it, and who's got a big agenda that he's trying to get across. The last thing he wants to do is ignite another firestorm on the domestic front. And so that's where that kind of reluctance is coming from what I'm hearing. However, it may be that we don't really have a choice, particularly as these Thanksgiving cases continue to spike up and as Delta continues to hold sway, even as Omicron emerges as the latest threat hovering over this nation that's already weary of having to deal with masks and shots.
Paul, let's turn to Europe. We're seeing a number of countries taking steps in recent days to try and limit contacts amid these surges that we're seeing. What are some of the countries that stand out in your mind?
Well, there's certainly no single response Europe-wide. Every country has a different response, and those are changing every day. And even here in Germany, we have a new government coming to power this week. The government of Angela Merkel is leaving, and a new government is coming in, which is made up of three parties: Social Democrats, Greens, and Liberals. And each of those three parties have different stands. So, I mean, you have, for example, in Austria, where there was also a change at the head of government because of, not least, the spike in cases there, and their vaccinations have become mandatory. There are other places in Germany, for example, where they're talking about next year making vaccinations mandatory. At the same time, in Germany, for example, right now, there are ever greater restrictions on travel, both coming and going. Masks are being required, or vaccination certificates to get into ever more public events. That's changing also almost by the day. So we've got a situation where, to be honest, nobody's really sure exactly what the situation is going to be tomorrow. I mean, there are ever greater restrictions. There's ever greater emphasis on getting vaccines. Ever more people are getting boosted. More children are getting vaccinated every single day. Interestingly, a new poll in Germany showed that over 70% of the population is in favor of a full lockdown. So, I mean, ultimately, in terms of what the majority of people think here in Germany, the government, either the one that's in power and leaving, or the one that's coming in, has also been making legislation, are behind the curve.
Interesting. Well, Bill, COVAX, of course, is a part of the World Health Organization. It was designed to prevent or at least mitigate this vaccine inequality. Vaccines have been pledged by a number of Western countries, but the jabs just aren't getting into the arms of a lot of folks in need. WHO epidemiologist Dr. Maria von Kerkhove talked about this on CBS's Face the Nation this weekend. Let's listen to what she had to say.
I think there's a combination of factors of why COVAX has not had access to the vaccine to be able to distribute those to those who are most at risk in all countries. It's a matter of having enough production. It's a matter of having the deals in place with manufacturers, with the companies that are producing these vaccines, to be able to get those to the countries who need them most. And it's not a failure of COVAX to be able to deliver. The failure is the ability to have access to those vaccines to deliver. It's more than just rhetoric. What we need are to be able to purchase them ourselves, to get in line, to get ahead of the line, so that those vaccines can actually go to those countries in need.
Does she have a point, Bill?
She definitely has a point. I would say the first and most important point is production. People have warned that there would be pandemics for a long time. I trace it back over 30 years. People have been warning this would happen, and yet the world did not build vaccine manufacturing capacity. There's just a handful of plants in Africa and South America and other major geographical locations. We need to ramp that up, not only for this vaccine, for many others. I don't blame countries for vaccinating their own country first, but I do think it's absolutely critical that we increase vaccine manufacturing around the world. And I don't think the plants are going to be the problem. I think it's the vaccine manufacturing, which has really been the bottleneck. And that is, people are working like crazy to try to change that. Beyond that, I would point out when people say that if you get the vaccine, countries don't have the infrastructure to deliver it, all countries have the ability to vaccinate their children. There are well-developed programs that have been developed over the last 30, 40 years that make sure that no matter where you are in those countries, no matter what the income level is, children get vaccinated. I've visited the most remote parts of the world where there are children who are on record as being vaccinated. So it isn't beyond the capacity of countries, even very poor countries, to vaccinate their population. I think we have to tie into those pre-existing networks. In Africa, we should be tying into the PEPFAR and the Global Fund, HIV control networks, very well-established networks. So I think there are things that can be done. In addition to increasing the vaccine supply, making sure that that is a local supply as fast as we can and for the future, as well as working on the distribution of these vaccines. We can do a lot better than we've done.
And Peter, you know, there's been this debate here in the United States, and it's been pointed at the U.S. president, you know, these booster shots. Let's get the booster shots. While so many people don't even have a first shot, and there's a lot of people who say, look, we've got to inoculate the world, because if a new variant starts somewhere else in the world, it's going to hit here in the United States at some point. How do you kind of balance these two objectives?
Well, Mike, my answer is always going to be yes and yes to that question. Yes, I do think that boosters do have a role to play, certainly from the data we have. And yes, we have to solve some of those thorny issues that Bill brought up, not only in, you know, maybe increasing production and taking advantage of that infrastructure in developing countries, but also addressing hesitancy. You know, speaking for somebody who comes originally from the Caribbean, I know that there's hesitancy in many parts of the world. Only 25% of some healthcare workers in African countries want to be immunized. So I think we kind of need a multi-pronged approach.
How do you get around that, though? Because 40% of the country still not vaccinated here in the United States. We've got Delta, now we have this new variant. And it seems like that's the drumbeat. We got to get you vaccinated. And a lot of people just are like, I'm not going to do it.
I know it's going to be really tough. You know, so far we've been buoyed at some point by natural infection plus vaccine distribution. So say like a state like Florida, right now, you know, Omicron notwithstanding, they're kind of in a lull, and that's because there's vaccine, but they're also hit hard recently by Delta. But if Omicron is as advertised, it may not be enough to have natural infection. So yes, a lot of, you know, potential worries for a lot of people coming up soon.
Joseph, President Biden's poll numbers, they're continuing to drop. You mentioned they're in the 40s. Clearly, a lot of that has to do with the economy and inflation. But how much is the pandemic and his handling of the pandemic hurting his presidency? Because this was the one issue that he ran on.
Well, exactly. And it seems that he's got a real paradox on his hands. I think a fair degree of this is the economy. A fair degree of this is national anxiety over any kind of transition. And another fair chunk of it is due to the virus, which has an impact on the other two. So I think one of the biggest problems that he has, and the biggest paradox that he's facing here, is that people are blaming him for not doing enough to control the virus, while the people themselves, 40% of the population, isn't doing enough to control the virus. And you've got a lot of things that are changing day by day. A lot of people are trying to keep up with what's going on between Delta, Omicron, masks, no masks, boosters, vaccinate the world. It's all a lot, and it's got Americans feeling really kind of confused. The heads are spinning, and they're going to blame it on the guy in charge. Now, fortunately, there are ways out of this, but nobody sees a way out of it that's anything short of going to cause another controversy, mainly because his predecessor politicized this vaccine so much, and that politics, the politicization of public health, is still raging. And it's unfortunate because lives are being lost in the process, and we all know what works, and it's mystifying why some people simply refuse to do it.
Well, you brought up his predecessor. The Washington Post has a front page story today talking about Donald Trump. They retraced the former president's steps after he was testing positive over a 7-day period, and they determined that he came in close contact with 500 people during that period of time. And the article calls into question his actions and the chief of staff at the time, Mark Meadows. In fact, some of his former aides seem to be pretty angry about this. I want to get your take on that.
Well, basically, it puts a sharp point on some things a lot of people had suspected. You recall after he became hospitalized, not long after his debate with Joe Biden, there was a lot of question about how many people he put at risk then, and even backtracking then, you realize that this guy, that the former president, he's in touch with a lot of people coming and going in and out of his office. He was the cheerleader against masks. He was the cheerleader against any kind of effective reaction to this virus. So a lot of people are justifiably angry about this, but a lot of other people are just kind of saying, well, yes, this is just another one, stack it over on the pile to the left, because we had a president who was at the very least careless and at very most reckless about how this pandemic came to be and how it swept through the United States. So it's not surprising at all, particularly when we had him hospitalized, and there were a lot of his aides, including Mark Meadows, who were trying to communicate and maybe downplay at the same time, publicly communicate that he was fine and everything was okay, but kind of downplay, or rather, on the other hand, try to warn either tacitly or surreptitiously that things were a lot worse with the president and his hospitalization than they were willing to say, at least out front, lest they risk his ire.
Bill, Trump is no longer on social media, but social media is still a big problem for this president, this administration, misinformation, and as Joseph was saying, the politicization of all of this. How do you attack that, and what's the right approach to try and get more people interested in getting the vaccinations? Because obviously you're not going to turn the corner until you get that.
I think there are a couple of, let me talk about a medical strategy that might work. I've written something called belt and suspenders, that it is conceivably possible that a combination of vaccines and prophylactic antibody treatments could help stem the epidemic, even for those who aren't willing to be vaccinated. You get one shot of some of these new vaccines, and it's not even intravenous. Now it's a intermuscular or subcutaneous injection. And you may be as well protected as a vaccine for 4 to 8 months. 4 to 8 months. So if I were, and I think you're beginning to see that in the new policy, let's add monoclonal antibodies. And there's at least 2 companies, big companies, that are now making those. And I think that's a very good sign. Actually, there are more than 2 companies. Actually, there are 3 now that I can think of that are beginning to advertise those. And one of Biden's policies is let's get as many of those shots into the arm for people who might be vaccine resistant. And if you're at a high risk, in a high-risk group, say you're living in a communal setting with a lot of older people who are vulnerable, even if you're vaccinated, it might be a good idea to get one of those shots. And that's what I call belt and suspenders. Or for those people who don't want the belt, at least wear the suspenders.
Yeah. Peter, I saw you nodding your head. I'm sure that this is something that you and your colleagues must talk about a lot, not just healthcare, but how do we get people to buy into this? What are some of your thoughts on this?
Well, Mike, we've learned about using carrots. We've tried a lot of carrots during the pandemic. Lotteries, a shot for a shot, ice cream, what have you. Suddenly found out after a while that mandates seem to really work much better than people had thought of. We've cited the example in New York City with, some of their municipal workers. But in LA, for example, in the Unified School District, there was probably 80% vaccine uptake before the deadline. And the deadline came and everybody rushed to get it. And it was like 97% in the LA Unified School District. So we can't underestimate the power of mandates. And then, of course, one size doesn't fit all, as Bill was saying. I would add, in addition to long-acting monoclonal antibodies and to vaccines, I think as we use more and more or have access to more oral options like molnupiravir and Paxlovid from Pfizer, that may address some individuals' hesitancy as well. For example, if I had COVID in a household, and of course we don't have data yet, but somebody else is exposed to me, I could potentially give them an oral pill to prevent, as in a post-exposure prophylaxis, them from getting it. So what you're doing in all of these options is just getting the community viral load down, and maybe that might lead to at least trying to have some control.
Joseph, there's always this economic piece to COVID, and I'm sure you've heard about this cruise ship in New Orleans. 17 people tested positive, including one probable case carrying this new variant. Cruise lines have been hammered by this pandemic. Carnival, for example, sold off 6 ships because they had lost $4.5 billion in the second quarter of 2020. The cruise industry was hoping to rebound, and we keep seeing this with travel where they just feel like maybe we've turned the corner and then this happens. Talk to us about the economic devastation of what we're seeing with this.
Well, they go hand in hand. The recession that we just or on the brink of coming out of until Delta kind of hammered, it makes plain that mandates making public health first and foremost economic strategy as well as a public health strategy really needs to happen because after all, we know that nobody's safe until everyone is safe, and the virus is going to get the last word here. We thought we turned the corner earlier this year. We thought we were going to have the summer of freedom. That didn't really happen, mainly because we do have hesitancy. We do have people who are suspicious. We have loads of misinformation out there, and it's just a Pandora's box that has been opened that we can't seem to get the lid back on.
Bill, let me fire the last question at you. We know about resistance to antibiotics, and I was reading that some vaccine experts say that numerous booster shots, there is the chance that it's going to make these future vaccines not as effective. I want to get your thoughts on that. Is that a concern?
Virus variation that avoids neutralization by vaccines is a major concern. We've already seen that with some of the variants. Now, the hope is that if you have a high enough antibodies, and you had a clip where Tony Fauci was saying exactly that, it might be broad enough to stop infections or at least slow infections in many people. And if it doesn't do that, as one of the other guests said, maybe your T and B cells will save your life.
Bill, we've got
So
maybe...
that is the hope. However, it is only a hope, and it's not based on any real long-term evidence. What I see when I started looking at variants over a year ago, and I would say it even underscore today, we have only begun to understand how tricky this virus is, how many ways it has to vary, how many ways it can become more infectious and more lethal. Let me just remind people that its sister kills 10% of the people it infects, and its cousin MERS kills 30%. This is killing somewhat less than 1%. So this virus has a long, long way to go, and we have to be prepared for that. And that is why it's imperative to do the things everybody on this panel has been talking about. Working on public opinion, working on global vaccine distribution, working like heck on science so we can get better and more effective treatments. We've really got to keep this front and center in the public health, scientific, and in the information sphere. It's really important to try to get this thing under control, or we will be having this discussion year after year for the next X number of years if we don't. It's a really serious problem.
Bill, thanks so much, and thanks to all of our guests. Very illuminating conversation. Appreciate it. And that is it for this edition of The Heat. I'm Mike Walter in Washington, D.C. Thanks so much for watching.